Hello, welcome to Let's Talk Health with Dr. Chris. We are still discussing diabetic self care. If you've not watched the previous episodes, please do wait to watch them so that you will understand where we are going. Today, we are discussing the problems of gatekeeper malfunction or non medically as insulin resistance. The first problem, as we said before, there are two problems, the starvation problem and stagnation problem. To the starvation problem, because the gatekeeper is not functioning well, the body cells are denied access to glucose for energy production. As a result, the cells are starved of energy. This is the reason why diabetics are always hungry. And in order to compensate for glucose, the body will improvise by breaking down body fats into alternative sources of energy called ketones. And this is the reason why diabetes can lose so much body fat within a short period. It is also the basics for the so-called ketogenic diet or keto diet. These ketones will give the diabetic an offensive breath that's uh, like alcohol. It's called ketone breath. And this ketone production can be very high, especially in people with type 1 diabetes. And it can lead to a very serious medical emergency, which is called diabetes ketoacidosis, which can also lead to coma. But this extreme only occurs in type 1 diabetes. So that is a problem of starvation. The body cells, tissues are starved of energy or a starved of glucose for energy production. Then the second problem is the problem of stagnation or buildup of sugar in the blood because the glucose in the blood is taken into the body cells very slowly in people with diabetes due to absence of insulin or insulin resistance. The glucose level build up in the blood. Because if you want to compare the rate of absorption of glucose into the from the blood in a healthy person to that of a diabetic, it would be like comparing pouring a bucket of water on a tiled floor and that of a sandy floor. The water poured on the sandy floor will be quickly absorbed, while that poured on a tiled floor will take a long time to be absorbed. So glucose absorption in the body of somebody that is healthy is like water poured on a sandy floor. While that glucose absorption in somebody with diabetes can be likened to water poured on a tiled floor. So the absorption from a diabetic is so slow that glucose will build up in the blood. So the build-up or stagnation of glucose in the blood, and it has some consequences. It has some serious consequences. It will now absorb water from the surrounding body tissues by process of osmosis. And this is what makes people with diabetes become thirsty. They're always thirsty and dry. The body looks dry. So the buildup can be so much that it will affect body function and lead to a medical emergency and coma. However, the main problem of this stagnation is that the buildup of this glucose in the blood can lead to a situation where the solid glucose is precipitated and it will coat different body organs, the blood vessel in different body organs, and this is like an iced cake. So this icing of the body tissue is what lead to most diabetic complications. The goal of diabetic control, therefore, should include to ensure that the blood sugar level is maintained at a level that will prevent it from being high enough to warrant icing of body tissues and blood vessels. The next thing we want to discuss is what are the symptoms? How do you know somebody that has diabetes? So there are some complaints that are expected from somebody that has diabetes. It will include excessive urination, hunger, the person become thirsty. There may also be weight loss, especially in type 1 diabetes. There may be weight loss, severe weight loss. Other complaints may not be related to the complications, which we are going to discuss in the next episode.